All right, so we're gonna do our blood draw on the lateral saphenous vein of this dog. So I'm going to take a 3 cc syringe and I'm going to attach my 22 gauge needle. I've got my purple top ready for me to put in my sample once I collect it. Patient's leg has already been shaped, so I'm going to put alcohol over the vein. My technician is already helping by holding off for me. Go ahead and uncap my needle. And with the bevel facing up, I'm going to go into the skin, draw back for my sample. That should be enough. I'll hold off, and then I'll ask my technician to hold off for me. Go ahead and recap my needle, and then I can place my sample into my tube. Perfect. I'll be able to sharp those once I'm finished. And then I'm also going to apply a Band-Aid, which is a little bit of vet wrap and a cotton ball, just to kind of help that area clot. Place it over my injection site, wrap around tight enough to hold pressure, but not too tight. There we go. And then I'm going to set my timer for 15 minutes so that I know when to take it off. So I'm going to be running a BMVT test on this neuro patient. So I'm going to go ahead and get off my device. Okay. Already got my safety off. So what I'm going to do is take where this arrow is and put it on the gum of the patient. I want to make sure that I'm not pressing down too hard to give myself any false readings, and make sure I avoid any vessels. So I'm going to push down and then click and release. And I'm going to start my timer. And then as the blood starts to drip, I'm going to go ahead and just wick away from it with my wipes. I want to make sure to not touch where I have poked before. It's starting to slow down just a little bit. All right. And I think at this point we can say that he's pretty well clotted, so I'll go ahead and stop my timer. And I'm at 2.5 minutes, which is appropriate for it being a dog between 2 to 4. Thank you. Now I'm going to demonstrate how to make a blood slide, as well as stain it, and give a description of how to briefly read it. First, we're going to get started by taking our blood sample from what I have right now is a green top tube. I'm going to take a 1 cc syringe and drop a little bit of the sample. I have a 22 gauge needle, and all I'm going to need is a little bit. Go ahead and recap my sample. All right, so So now I'm going to take my Clin slide and I'm going to add a small drop of blood. Oh, that's going to be too much. Alright, so here's my small drop. Next I'm going to take my second slide and I'm going to hold on to my first slide at the base. I'm going to take my second slide and make sure that I have a good angle. I'm going to come back towards my sample and then push straight out. And that's going to be my slide. I'm going to go ahead and dry it off really well. Okay, so this is going to be our stain. It's our right stain, so the 3-step process. So we actually have this handy dandy thing to hold our slides, so I'm going to go ahead and put those in there. And I have made sure that all of my slides are dry. If you can kind of see that a little bit. Alright, gonna make sure I also change out our dirty water. Dump it, go ahead and refill that. That should be enough. Alright, so to get started, I'm going to go ahead and dip it into my blue. And I'm going to do this 10 total dips. Number of dips doesn't really matter as much as it's just about 30 seconds. That's 10. I'll go ahead and take all my lids off. Alright, next. Alright, and the last step. Go ahead and put it into our water to rinse. Set that down, get a little stream started so I can clean it off a little bit better. Over here. I'll just make sure that it's real gentle. Don't want it to be too strong of a stream. Alright, I'm happy with that. Turn that off. Alright, and last thing I'm going to do is talk about how to read the slides. I'm going to make sure that my microscope is set to the 10x. It's going to be important. Go ahead and flip it on. There it goes. I'm going to drop my stage all the way. Perfect. What these look like. Alright, there's one. Not totally even, but definitely has a feathered edge. Looks good. And the next one, this one was the second one, not so good, but still a little bit of a feathered edge. And the third one, this is probably second best, but definitely not the best. So I'll go ahead and set up this slide to be read. So I'm going to make sure that it's fairly dry. Set it up on my stage. First, I'm going to focus here, get everything brought up as close as it can to my actual lens, focus in really well, and then we'll increase from there. So I'm going to look through, use my knobs on the side to focus, use my macro first. If I can get it into view. Oh, there it is. All right, perfect. So once I'm there, then I can go ahead and increase to my 40x. I'm going to go ahead and use the micro knob to refocus on my cells. Perfect. At this point, I'll be able to find my monolayer. Keep going to the side. Definitely see some white blood cells in here already. All right. So I am pretty confident that I have found it. I think it looks great. At the 10x level, you can evaluate where your monolayers are, as well as just general cell count, seeing what they look like overall shapes. A little bit easier to see in broad spectrum. And then as we increase, we're going to increase all the way up to the 1000 times view, and that's going to be where we'll count our white blood cells. So I'm going to shift over. I like to stop in the middle right here, and this is where I'm going to get my oil. All right, and I'm going to do just a dab. Perfect. And then I'll move my lens over. This is the 1000 times with the oil. So I'm going to go ahead and refocus. All right. Perfect. I can definitely see a lot of little spicules on my red blood cells. I see a little bit of platelet clumping. But so what my goal is going to be for counting white blood cells, I'm going to go ahead and count 100 white blood cells. With that 100 count, I'm going to notate which of these are neutrophils, band neutrophils, eosinophils, monocytes, lymphocytes, and leukocytes, I'm sorry, not lymphocytes, as well as our basophils. Basophils aren't seen as common in canines and feline slides, but they can be seen. So I'll notate those six different white blood cells. So neutrophils, band neutrophils, eosinophils, leukocytes, monocytes, and basophils. Yeah, sorry, just wanted to double check that I got all of them. So I'll notate those, and then that can help me, once I do my differential count, then that will be able to help me get all of my percentage calculations for how many white blood cells are in the slide at a time. The chemistry test we're going to be running today is going to be our NOVA. It tests for a broad spectrum of values, but the main ones that we're going to be looking at are our liver values, our ALT and ALP, our kidney values, which are BUN and creatinine, as well as our glucose and our lactate. So what I'm going to do first is I'm going to come up to the machine and place in my patient number. So I'll select that. Sure. I'm going to add additional information. This is the same sample that we used for our PCV and total solids. So it is a venous sample from a patient that is here for an elective surgery. So I'm going to enter in those PCV values, which is 45, and then our total solids, which was 7. and hit enter. Then I'm going to hit save. So before I hit start, I'm going to want to draw up my sample. I'm going to be using a 1cc syringe as well as just any size needle. Mine happens to be 20. Open up my sample, off my needle, draw up my sample. We like to have at least 0.3. That usually makes sure that we have enough. Close the lid. Perfect. So I'm going to recap my needle. And then next we're going to use a clot catcher. So I'm going to attach it to the top of my syringe, and then I'm going to hit start on the machine. It's going to pull out a little needle, which is what it's going to use to aspirate my sample. And then I'm going to inject the blood into our clot catcher to ensure that we have no clots that would mess up the machine. So the needle is out. I'm going to put my sample underneath, stick the needle in, and then hit aspirate. It aspirates the sample. I'll pull it out and then hit continue. And now it's going to start to run. To finish up, we'll go ahead and pull back the rest of our blood sample, toss our clot catcher away, and put our blood back into our green top tube in case we need to rerun it or something goes wrong with our current test. I'll throw my needle and my syringe in the sharps container, and then we'll wait for the machine to process. Great. So now that it is complete running our chemistry panel, I'm going to hit release, which is here on the bottom of the screen. Once I do that, it releases it to our program that keeps all of our patient records, which is all on the computer. And then it's also going to print me out a copy, which I can hand deliver to my doctor. So I'm going to be doing an ELISA heartworm snap test on my IDEX. I'm going to go ahead and open up my test, pull out my pipette, and my snap. I'm going to take 4 drops of my conjugate and put it in my little test tube. That's 4 drops. Next, I'm going to open up my venous sample we just got from a dog that came in for her annual vaccines. And draw that up. It's in a purple top tube. I'm going to take 3 drops of that as well. 1, 2, 3. Place the rest of the sample back in my cup and put that away. Recap my sample. And I can invert my tube just a few times. And then I'm going to pour it into the well and the top of the snap test. I'll pour that in. I'm going to wait until the blood makes it all the way up to the activation circle at the top, and then I will snap it. Right, so as soon as it comes through that activation circle, I'm going to snap it all the way down, make sure that it's flush, and leave it on a horizontal surface. I'm also going to start my timer for 8 minutes, and then once that's completed, we'll be able to read it. Alright, so coming down to the end of our 8-minute timer. Alright, and our heartworm test is negative. Okay, so we're going to be performing our PCV and total solids. We have a venous sample from a patient that is here for an elective surgery. We place the sample into a green top tube to avoid it from clotting. And that's what we're going to be drawing our sample from. So I'm going to open up my tube. I'm going to pour in my blood into the hematocrit tube until it is almost full. I'll stop, set down my sample, and then I'm going to use the clay to stop it on one end. Make sure that it is sealed, and it is. Place it in one section of my centrifuge. And then I'm going to do it again. Having two samples, make sure that I have the ability in case one of them breaks, as well as balancing my centrifuge. I'll pour in my sample, close to the end. I'm going to close it off. Seal it again. It is sealed, so I'll place it on the opposite side in my centrifuge. That way I know that it's balanced. I'll close my centrifuge lid and lock it shut. Cap off my sample. And then I'm going to hit run and then hit spin. And then it's going to spin. Now that my centrifuge is stopped, I'm going to unlock the lid, lift it up, take out one of my samples. That's what it looks like. To read for my packed cell volume, I'm going to take where the clay meets the packed red blood cells and place it on the 0 line at the bottom of the chart. And then I'm going to take the top of where my plasma meets the air and line it up with the top. And then I'm going to read the line where my red blood cells meet the plasma, which, looking here, it lines up with the 45, so 45% packed cell volume. Now after that, I'm going to check my total solids, so I'll open up my refractometer. I'm going to break it close to where the red blood cells are, but not in the red blood cells. Crack it open, put my hand over the refractometer, careful not to touch it as to break it. And I'm going to hit the table to get the sample on there, which looks great. Have a little bit of glass, I'm going to go ahead and get that off. There we go. Close my lid. I'll look up into the light, and it reads at about 7 for the total solids. And that's how you get your PCV and your total solids.